I think it's really important for the engineers or physicists or whoever working on it to have a feel for how it translates into real world use or utility. So for example, if you have something that you need a blood sample to do some tests, if you have to be there and watch someone take blood samples, you're not going to do something that requires hourly sampling. You have to have an understanding of what it means to actually put it into practice, and that has to fold back into the design to a certain extent of what you're designing. So I think that's important. I think it's also important because you need to talk to clinicians. You need to be able to understand what their problems are, what they see. And actually one of the important things is to expose the clinicians to the engineers. So I think that's just as important as exposing the engineers to the clinicians. And one thing we found is that a lot of the clinicians start out by saying, please fix this for me, when an engineer comes in. And we've tried to kind of change that and change their mindset to, here's what we want to learn. Here's what we need to measure to understand what's happening with this patient. And they, can translate this to the engineers, and the engineers can then go out and try to, again, work together to find a solution for it. And that's very different than kind of typical engineers in a hospital where you go and say, I want better resolution, or can make this scan go faster. It's a totally different mindset. So I think we're changing the mindset. They're trying to change the mindset from both sides. Again, having the people doing the research understand the actual applicability and utility in the clinic rather, and having the clinicians really think about the real questions that they need answered and ask that of the groups doing the research.